Colin, thanks for coming in today. Appreciate you spending this time with us. You're the first patient to come and talk to us about a melanoma. So we really value what you have to say today. The first question I usually ask is about how your condition came to light. What were the early signs and symptoms?
Okay, so the first time it came to light was as a mole on my leg that had always been there as long as I can remember, right from a child, and it started changing colour, getting bigger, getting itchy, and even on occasions bleeding. My wife nagged me, sent me off to the GP, and GP immediately referred me into Loughborough Hospital, which is our local hospital, and probably got that mole taken away within probably 2 or 3 weeks of first going to the GP under a sort of a local anaesthetic, a procedure that took probably no more than half an hour or something like that.
Yeah.
And they then sent that away, the sample away to be tested. The results came back, and they then realised that it was a melanoma, so they then had to take further skin samples to make sure they'd excised all the melanoma and got a good boundary around it.
Yeah.
And that was exactly the same sort of procedure as before. Very simple procedure, very easy, and no real recovery as far as I was concerned. It's just like having a blister or sort of just some wound or whatever that you put a plaster on.
So if people were worried about that, who are watching at that early stage, they can be reassured. It's usually quite straightforward to have that.
It's very straightforward, very quick, very like a minor surgery, the type of thing of like having a toenail or something like that taken away or whatever. No issues there at all.
Now they recalled you because they knew it was a melanoma and went into that more extensive procedure. But did you then start to look up information about melanoma? Were you given the information at the time?
So I had a consultant called Dr. Nicholson, who's a skin consultant, and he said to me, he said it's up to you, but I recommend that you don't look it up on the internet.
Interesting.
I did. And I understood why he recommended that you didn't look it up on the internet. There are so many things out there on the internet, especially American websites, that are just so confusing that it's very difficult to actually get to proper information, qualitative information that you can apply to yourself. And I within a month of having been diagnosed with that, I resolved that whatever happened next, I wouldn't go back onto the internet again and look it up, because there's all sorts of things. There's places where they start talking about percentage chance of survival and things like that.
Sure.
And you don't know enough to be able to put that in there. And actually, percentage chance isn't really relevant. It's it's me. It's my case. I'm one person. I'm not 100 people. So I'm not interested in that. That was the view that I took.
Yes, because your specialist clinician, your oncologist, will be able to tailor the expert knowledge for you, and basically give you a much more individualized discussion and information.
Absolutely, and a lot of the stuff in order to get the outputs, you've got to put information in that you don't really know anyway. And as I say, a lot of it is Americanized. That I found anyway at the time was that it wasn't relevant to what was happening over here in the UK and how we were treated.
So, what was your outlook at that stage, having looked it up, got a bit of a surprise or shock, and then kind of returned to the clinic maybe to discuss it a bit more?
So my outlook on that was sort of, right, okay, well, you've taken that mole away now. The response on the tests was there was a good margin around that mole, and I wasn't actually into oncology at the time. I was kept in the skin clinic, and they were just sort of like, right, no problem. We'll just keep you under observation, see what happens. But you need to check your own body and keep checking. and made sure that I could refer myself back in. They were very good about making sure that I'd got contact details, so that I could refer myself back in at any moment if I wanted to.
Now, skin cancer is interesting in a way because it generally is visible if it's on the surface. So there is the option for you to do a self-monitoring type of role where you're keeping a close eye on it. But I know what a lot of other patients say, which is that can cause them quite a lot of anxiety, some of the time anyway. In other words, you can be preoccupied by checking it sometimes. How do you find that balance between thinking about it too much and always looking to see what's happening?
So nowadays I don't look on my skin because I think the way things have developed, I'm not a moly person, so it's not hard. Dr. Nicholson first off suggested just checking around in the shower once a week or whatever. If you check every day, then you won't spot the differences. So you've got to have a regime about it, that if you're going to do it, that says, I'm going to leave it for so long, because otherwise you won't spot the differences if you look at it every day.
I can see that logic.
And that logic that Dr. Nicholson put across appealed to me, and resonated with me. So that was fine. But it wasn't just about the skin, it was about checking lymph nodes and what have you, and that was the important thing as far as I was concerned in the end.
Yeah, that's a good point, because